tonight's Health Connection, we're joined by Jeff Sepik from Anthem Bluecross Bluesheild. So first, thanks for coming in tonight. We appreciate it.
My pleasure.
This is always a topic it makes everyone's skin crawl when we have to talk about insurance. I know when we were doing open enrollment here, everybody wanted to pull out their hair because it can be a stressful time, but very, very, very important, right?
It's really important, and this is a really stressful time. Everyone's going through deciding what benefit plans they want now. And I think one of the things we're excited about that we're trying to do differently is partnering with the providers here in Colorado Springs to really try and bring care coordination to the member, to have patients have better outcomes and at really lower costs. So two of the folks we're working with are Colorado Springs Health Partners and Mountain View Medical. So we're very excited about that partnership. It's really unique, and hopefully it'll simplify things for our patients.
Yeah, it seems to give people an instant headache. But talk a little bit about the Colorado Healthcare Exchange and what kind of changes that we're going to be seeing here soon.
Yeah, the exchange is going to bring a complete change to how people buy and what options they have. So we've been preparing for this for about a year.
Yeah.
I think a lot of people have been taking a wait and see to see what the election would do, to see what the Supreme Court decision would be. But folks who had never had insurance are going to all of a sudden have a place to go to buy health care. And again, the goal is to try and make it simple, to try and make the plans somewhat standardized. And so we've been spending about a year making sure that we give people choices and that it's easy to understand.
What's probably the most common question that you hear from clients?
I think the first thing people ask is my doctor in your network?
Yeah.
Do I have access to the people that I've worked with for a long time? So we're very lucky to have a very broad network here in Colorado Springs and throughout the state of Colorado, and we're continually trying to look for ways to partner with our providers in a different way.
And would you say that the changes that are coming, are they positive? What's so great about them? What's the good news about it?
I think it is positive. I think a lot of people were very nervous about the Health Care Act and the PPACA and the exchanges, but I think in general it's driving people to think differently, to look for creative solutions, to try and find ways to lower costs, but do it in a way that provides better health care to the member, and to allow more of an interaction between the member or the patient and their primary care physician. That's something we're really strongly behind, and we're going in directions that are new for us and unique for us, and I think will bring value.
Yeah. Do you have it all broken down on your website as far as maybe like frequently asked questions or the changes that are coming up and what folks will have to decide and what their choices and options are?
We do. We have a number of sections on our website that speak just about the changes due to healthcare reform. We have ways for them to find their providers and to learn about some of the plans and options that we have.
All right, very good. Well, thanks so much for coming in tonight.
It's my
We really
pleasure.
appreciate it. I know it can be a little stressful, but having someone that's knowledgeable about it that can kind of guide you through it always helps.
Yeah, thank you so much.
Have someone over their shoulder or something, right?
Appreciate the invitation.
No problem. All right, we are back right after this break.